Hey guys, I hope you all are doing well. Welcome back to my channel. Today we're gonna do the ENT history taking. If you haven't seen my gynecological history taking video, please go and check that out as well. Today we're gonna start the ENT history taking. How do you take the history of the ear, nose and throat? You have a patient in front of you. Firstly, you're gonna introduce yourself, okay? And then you're gonna ask the patient's consent if you're allowed to ask some questions. The first question you're gonna ask about is the biodata of the patient. What is included in the biodata is a patient's name, age, gender, occupation, address, education, and the date and time of examination. Okay, you will write everything in the biodata. The next heading which you're going to write about is the presenting complaint. Okay, why did the patient come to the hospital? What's the primary complaint? And you're going to write this in very easy and the layman terms. For example, if the patient says that he has a swelling on the neck, you're going to write that it is a swelling on the anterior part of the neck, okay, on the right side, on the left side, whatever. Okay, if the patient says that he has pain in his throat, you're going to write that. Okay, you will not use any medical terms, and you will start in the patient's own words that the patient complains of whatever his issue is, and then these complaints must be listed in the order of the importance and their onset, and it should always be listed in a chronological order. Okay, the thing which happened first, for example, the patient had ear pain 3 years ago, and now he has started ear discharge 3 weeks ago. So first you will mention what happened 3 years ago, and then you will mention what happened 3 weeks ago. Okay, in this order. The thing which happened first, it will always appear first, and the thing which happened the last will appear last. Okay, presenting complaint. Next we move on to the history of presenting complaint. HOPC, history of the presenting complaint. You will, whatever the presenting complaint is, you will write a detailed description of the pain, of the discharge or anything. Okay, for pain we use a criteria that is the Socrates criteria. S is for site, O is for onset, okay, where the pain occurs, when does it occur, C is for character, whether it is sharp or dull, okay, R is for radiation, which organs does it move up to, does it move to your back, your cheek, nose, etc. A is the association, what the pain is associated with. Then T is the time duration, okay, how long does the pain occur. E is the aggravating and the relieving factor, what triggers the pain and what relieves the pain. S is the severity of the pain, whether it is very severe or it is less severe. Okay, so you have to write about the pain if this is present, and what you will use the Socrates criteria, or you can also use the OPQRST criteria. Okay, this is also onset, progression. Wait, I'll write it. This is the onset of anything, the progression, whether it is slow, fast, gradual. Okay, next we move on to Q. Q is the quality, R is the radiation, S is the severity, okay, and T is the timing. OPQRST. You can also use this, or you can use Socrates for pain. Okay, now if we move on to the detailed history, now we are moving on to the detailed history of ENT, HOPC. Okay, ENT, there are 3 components. E is for ear, N is for nose, and T is for throat. Okay, so first we're gonna take the history of the ear. If there is a primary issue in the ear, we're gonna take its history first. Okay, the first history which we're gonna take is for ear discharge. It is also known as what? It is known as otorrhea. Okay, we are gonna ask about its onset. When did it start? When did the discharge start? Next, duration. Is it continuous? Does the discharge keep flowing and keep flowing, or it is intermittent? It stops in the middle and then it starts to flow whenever you do a certain thing. For example, you wake up and then it starts, or you sleep then it starts. Side, whether it is unilateral or it is bilateral. Next, you move on to the character. In character, you have got some points which we are going to discuss. First one is the color. I hope you all can see. Yup. First one is the color. It can be, you can also write yellow, green, blood stained, okay. You can write clear, filled with mucus, mucoid, purulent, or blood stained, blood tinged or blood stained. You have to ask all these things from the patient, that what is the color of the discharge, ear discharge. Next, we move on to the amount of ear discharge, and it is usually measured in teaspoons. In the quantity is teaspoons. You're gonna ask how many teaspoons does the discharge come out of your ear every single day, right? And if the patient cannot answer that question, you will ask if the discharge is scanty or is it profuse. Next, you will ask about the smell of the discharge, whether it is odorless or it is foul smelling. If it is foul smelling, it can indicate chronic suppurative otitis media, okay. So this can be a differential if it is foul smelling, okay. Next, you will ask about the associated symptoms of ear discharge or otorrhea, and the first one is we're gonna ask about hearing loss. Hearing loss, then we will ask if it is uni or bilateral, okay. We'll ask about ear pain. Whenever the discharge comes, do you feel any pain? We will ask about fever, that whenever you experience ear discharge, do you have ear pain or fever? And fever suggests what? It suggests an infection. So you're gonna ask all these things, okay. And in the end, I'm gonna show you all the screenshots of this so that you can save this format with you as well and not have any issue. You will also ask about the triggers of ear discharge. That can also be an aggravating factor, okay, right? And the triggers which you're gonna ask is that, does the ear discharge happen after an acute respiratory tract infection, okay, or after an upper respiratory tract infection? Next, you're gonna ask after water entry, like in bathing or washing your hair or going to swimming. Do you experience ear discharge after that, or is it due to any trauma? Have you experienced any kind of trauma? Is there any foreign body insertion, for example inserting a stick in your ear to clean ear wax yourself manually, and after that you experience a lot of ear discharge? Is this a case of foreign body, right? So you will ask about all these triggers, okay. The next thing which you're gonna ask about is hearing loss, and you will ask about it in detail. If the patient experiences hearing loss, and you need to ask his history in detail. See, if the patient does not experience hearing loss, you will only write over here that the patient does not experience any hearing loss or any pain in the ear or any fever, okay. But if the patient says that yes, I experience a hearing loss in my left ear, then you're gonna ask his history, okay. So what comes in the history? First, you will ask about the onset of hearing loss, whether it is sudden, did it happen suddenly or was it gradual. You will ask about this. Then you're gonna ask about the progression. Is it stable, like it stays wherever it is, or it is improving, like can you hear now, or has it improved in the past year or in the past month, or is it worsening, like first it was unilateral and now it has started to get bilateral as well, okay. Next, you will ask about the side, which is uni or bilateral. In the case of unilateral, you're gonna ask whether it's on the right hand side or on the left hand side, okay. And you're gonna ask about the type of hearing loss, whether it is conductive or sensorineural. This will also come in the examination when we're gonna do Weber's and Rhine's test, okay. But in the history taking, you're not allowed to touch the patient. You only have to ask questions from the patients, right? So How to do that? First, we have conductive hearing loss. What question to ask for conductive hearing loss? We will ask that does your hearing improve in noisy environment? Okay, you will ask this question. Does your hearing improve in noisy environment? And for sensory neural hearing loss, we will ask both the questions. For sensory neural hearing loss, you will ask that whether you have difficulty to hear in noisy areas. Difficulty to hear noisy areas. Okay, so you will ask both the questions, and then according to that you will fix your statement. You will write whether the hearing loss is conductive or sensorineural according to the patient, without touching the patient, without doing any Weber's or Rhine's test, or without doing keeping the tuning fork on the patient. Okay, next you will ask about the associated symptoms with hearing loss. What are the symptoms that are associated with this loss? That is tinnitus. Okay, tinnitus means what? It means ringing of the ears. Okay, you will hear some bell kind of sounds. Okay, next we have vertigo. It is imbalance or discharge. You have already asked about discharge, so you can skip this as well. But if you started from hearing loss, if you have started your history taking from hearing loss, and if the patient's presenting complaint, see, your history will move according to this, the patient's statement of the presenting complaint. If he says that he has hearing loss since the last 3 years, and since the last 3 weeks he has ear discharge, first you will take the history of hearing loss, then you will take the history of ear discharge. Okay, it will not go the other way around, that first you will ask the ear discharge, then you will ask the hearing loss. No, whatever the patient says first, you will ask that first in the HOPC, and you will inquire about all those questions, and the questions will arise in a systematic manner. Okay. Alright, so we discussed the associated symptoms. Next we will ask about if the patient has used any hearing aid, any treatment to restore his deafness, or any previous hearing test done. Previous hearing tests and their results. Okay, you're gonna ask about this to the patient and then see what the patient responds with. Okay. The third condition we have is ear pain. If the patient comes to you and he has severe ear pain since the last 24 hours, and he has presented to the OPD, or he came to the emergency because he experienced ear pain, severe ear pain along with fever, and has been experiencing blood discharge as well. So you will ask about the ear pain, then you will ask about the discharge from his ear, that is blood stain. Okay. So what is ear pain called in a scientific language? It is known as otalgia. First you will ask about the onset. Was it sudden, gradual? Okay, sudden or gradual. Then you will ask about the duration. Okay, what comes in duration? We discussed over here that whether it is continuous, does the pain occur continuously, or it is intermittent. Then you will ask about the progression. If the person has a pain, for example, if the person has pain since the last 3 months, so you will ask whether the pain is stable, it is improving, or it is worsening. Okay, you will ask about the progression, right? Next you will ask about the type of pain. Is it sharp, dull, or a throbbing pain? You will ask about the radiation. Where does the pain go except the ear, that is to the jaw, throat, or head, neck, or any other area of the body wherever you feel pain whenever you have ear pain. Okay. Next you will ask about the relation with upper respiratory tract infection. That is, whenever you have an upper respiratory tract infection, then only do you have such issue of ear discharge, or does it happen every time? Or you will ask about chewing, that does the ear discharge happen, the ear pain happen whenever you're chewing or during jaw movement. Then you will ask about the associated symptoms. What are the associated symptoms with otalgia or ear pain? They are discharge, ear discharge, fever, sweating, and you will also ask about tinnitus and vertigo as well. Okay. Now, if the patient presents with the complaint of tinnitus, see, these all are main headings. And why are these main headings? Because the patient will come to you and he will say, okay, this is happening to me. So you will simply start, for example, patient comes and he has ear pain. So you will simply start with this format. If the patient comes with hearing loss, you will start this format. So the first complaint of the patient will be treated first, and after that you will ask all the other things. Okay. For example, in hearing loss, you will also ask about pain, fever, tinnitus, vertigo, everything, discharge, associated every symptom. But first you will complete this criteria of hearing loss. Okay. So now if the patient comes with a history of tinnitus, what is the first question I'm going to ask? The first question I'm going to ask is about the character. Whether it is ringing, a ringing sensation, buzzing, or pulsatile. Next, whether it is uni or bilateral. Whether it is intermittent or continuous. And this is the what? This is the duration. Next, I move on to the aggravating factors. That why does it increase? Does it increase in the presence of noise, or does it increase in the presence of lying down? Okay. Next, I will ask whether it is associated with vertigo or hearing loss or pain. Okay. So this is the history of tinnitus. Next, we move on to the history of vertigo. How do we ask whether the patient has vertigo? Whether it is true spinning, whether you actually feel that you're spinning, or it is just lightheadedness. Okay, some of the patients have a low blood glucose, low sugar, and that is why they may feel lightheaded and they may faint and they may think that their ears have an issue or their balance has an issue. So you have to check these things, and these all things will be checked in examination. Here only you have to ask the questions. Next, you will ask about the duration of lightheadedness, whether it is in seconds, like you feel very lightheaded achanak se, like suddenly, or you feel lightheaded for hours or even days. And if you feel lightheaded for hours or even days, this this is an indication of the Meniere's disease or labyrinthitis. Okay. So this history will help you in the differential diagnosis. So you have to remember this. Next, we have triggers. What triggers vertigo? What triggers lightheadedness? That is whether it is the head movement or your posture, or walking or running, or sitting in rides. Okay, for example, the rides in amusement parks. Next, you will ask about the associated symptoms. That is nausea, vomiting, hearing loss, or tinnitus, which is the ringing of the ears. Okay, so this is it. Next, you will ask about the past history of chronic suppurative otitis media. This is general. We will ask about the history of any ear trauma, accident, or mastoiditis. Right? And you will also ask about previous any surgical history of the ear, for example, mastoid exploration, tympanoplasty, audiometry. Okay, you will ask about audiometry, tympanoplasty, etc. Okay, so this completes the history of the ear. Okay, now what happens? The patient is coming to you and he only has the history of the ear, right? But still you will ask about the nose and throat as well, because all of these are connected. All of these are connected in the nasopharynx. Okay, so you will ask about the history of nose and throat as well. Now imagine that the person does not have any symptoms in the nose or throat, any bleeding, pain, okay, any sort of discharge from the nose, discharge from the throat, foul smelling, okay. no allergies, whatever, okay, everything is normal. So you will create a small paragraph and you will write that the review of the nose and throat is unremarkable, there is no abnormality, there is no history of discharge, bleeding, trauma, okay, or whether it is unilateral or bilateral, so there's no history, right? So when you have completed the HOPC of the whole ear, if the patient is coming with only with the complaint of the ear and you have completed it, then you will ask about the past medical history. In past medical history, as I have written over here, you can see there is no history of diabetes, hypertension, whatever you will ask. These are the common diseases which you have to ask, that are diabetes, hypertension, ischemic heart disease, asthma, tuberculosis, or any sexually transmitted disease, or any chronic illness which he has not been diagnosed in the past. Next, you will ask about past surgical history, any history of C-sections, okay, C-sections or tonsillectomy, mastoid exploration, audiometry, and next we have tympanoplasty, etc., any surgical history. We will also move on to drug history, that if the patient is allergic to any medications or has any known drug allergies or takes any drug, for example heroin, cigarette, pan, chalia, gutka, etc. Next we have allergy history, if the patient is allergic to pollen or dust, and if the patient is not allergic, so you will write not significant. You will also write about the history of anemia, the patient reports no anemia. Blood transfusion history, if the patient has the history of blood transfusion, you will mention that yes, whenever the patient had this operation, this operation, or whenever when the patient underwent such a trauma, then he had to undergo blood transfusion, and how many bottles of blood transfusion, and you will also write about his hemoglobin levels at that time of trauma, okay. So you have to write it like that. And in the case of a female, you have to ask about the past gynecological and the past obstetric history as well. See, if this is a female patient, I've asked about the past gynecological history and you have to mention it like that. The patient has no history of menstrual irregularities, abnormal vaginal discharge, pelvic pain, or any gynecological procedures, okay. And the past obs history, that it is unremarkable with no history of miscarriage, there is no history of miscarriage, complications, or any operative delivery, okay. So this is how you mention the past gynae and obs history in a female patient, alright. So we were over here on the family history. You will ask about any history of transmitted diseases, right? There is no history of similar swellings, tuberculosis, asthma, any malignancy, hypertension. Okay, you will ask about all these chronic diseases or ischemic heart disease, etc. Next, you move on to the occupational history. And whatever the patient does, for example, the patient is a coal miner, so you will definitely write that the patient is exposed to such pollutants and such irritants which may lead to issues in his throat and in his ear and whatever, okay. But if the patient is retired, or if the patient is a student and he's still studying, or the patient is very old and he does not leave his house, or if the patient is a housewife, you don't need to mention it. You need to ask it that what do you do, but you need to mention that this is not significant. This shows that you have paid attention to the detail and you have asked all the questions which are required in your normal format of a history taking, okay. So you have to mention that it is not significant as the patient is retired and he always stays at home, okay. Next, you move on to the immunization history. You will write that if the patient is an adult, you will write that the patient was immunized in his childhood. You will ask about the number of vaccines he received. You will ask about the immunization against COVID-19. If the patient had any trauma, fractures, or accidents, you will ask about the vaccine of tetanus toxin, okay. Tetanus toxoid, sorry, which has been given to that patient, okay. And in the case of children, you will write that the child has been immunized according to the EPI schedule, EPI advanced program schedule, right. So that is also known as the expanded program of immunization. You will write about that. Next, you move on to the nutritional history. You will ask the patient what he eats in a day, whether he consumes an adequate amount of fruits and vegetables in his diet, or whether he solely eats meat or drinks adequate water. So you will write about all of that, that the patient has a normal appetite and he eats a balanced diet. If this is the case, if this is not the case, you will write whatever the case is, that the patient is vegetarian, he avoids protein, or the patient does not drink adequate amount of water, or the patient has a large appetite as compared to a normal person and he is overeating junk food. Whatever the case is, you need to write that, okay. Next, you move on to the personal history. The personal history, you will ask the patient about the history of smoking, alcohol, any substance abuse, passive smoking especially, that whether he sits in the company of anyone who smokes, so that he will also get an effect of that. Okay, next you will ask about his sleeping pattern, that whether he completes his 8 hours of sleep at night, right, and does he experience any disturbance in sleep. You will ask about the bowel and the bladder habits of the patient, and if they are normal, you will just write a simple sentence: the patient's bowel and the bladder habits are all normal. Next you move on to the systematic review, and you will ask about the patient's ENT complaints, other ENT complaints. For example, you have asked about the ear, right, because the patient came with ear pain. Today we're going to do the history of the ear, right? So the patient was coming with ear pain and blood discharge from the ear as well, blood stained discharge. So you will ask only about the ear, and you will ask a bit about the nose, that you will write there were no ENT complaints like nasal obstruction, discharge, bleeding, dysphagia or dinophagia, or any ear discharge. Sorry, this case is different, that's why I've written ear discharge, but you will not write it here in case you're writing the history of the ear. The respiratory system is negative for cough, shortness of breath or hemoptysis. You will ask about the respiratory system, cough, shortness of breath. You will ask about cardiovascular system, any pain, palpitations, whether they are present or not. You will ask about GIT complaints, nausea, vomiting, urinary complaints, renal system, neurological complaints, neurological deficits. You will ask about everything, skin issues, eczema, right? These will also be included. Next, you will ask about the environmental history. Alright, so next you will ask about the environmental history, whether the patient is exposed to any industrial pollutants or lives in an industrial area where there are a lot of factories and a lot of pollution. You will ask about the passive smoking, about pets and their fur, because that can lead to asthma, that can lead to skin issues and diseases. Okay, you will ask about the pets. You will ask whether he attends public swimming pools regularly in case of infections, and you will ask about the travel history, whether the patient has traveled somewhere and has got the disease from there. Okay, so these are the things which you will ask in the environmental history. Next, you move on to the socio-economic status of the patient. The first sentence should be that how the patient lives, whether he is upper class, middle class, lower middle class, whatever. Okay, and you will ask whether the house is owned or it is rented. You will ask the number of rooms in the house. You will ask whether it is nicely ventilated or not, and you will ask about the electricity, water and the gas supply, if they have an adequate gas supply, or they use firewood or they use coal. In both of these cases, these can lead to respiratory abnormalities. That is why it is important to ask them. And you will ask about the water which they drink, whether they drink a boiled water or mineral water or tap water. This is important in order to check for the cases of typhoid and other diseases that can lead to ENT complications. Okay, you will ask the number of family members which live together and whether their house is ventilated or not. This is important in the case of respiratory infections again. And you will ask the number of breadwinners in their family, mineral water, electricity, gas, and whatever. What else is there? You will ask about mosquitoes, pollution in the area. You will ask whether the general conditions are safe and hygienic, and that's all. So let us revise. First, see, this is what I have made the history taking sample of. And the first thing which you're going to mention is the biodata of the patient. Let us read. 63-year-old main patient named Arsalan, son of Muhammad Abid. First you will write the name, then you will write the father's name. Okay, you will write the age and the gender. Is a resident of Baldia town. You have written the address, Karachi. He is retired. The occupation is that he is retired. He is presented to the outpatient department of the civil hospital on Saturday 24th May at 12:30 p.m. Okay, so what you have written the hospital, you have written where was he presented first, the date and the time. All of these things will be included in the biodata and you will write it as a sentence. Okay, complete sentence. Next you will move on to the presenting complaint. Okay, what you will write in the presenting complaint is wait a second, let us check for this because this is for ear discharge. Alright, so the same thing we have written in the biodata: her name, her gender, her age, her father's name, her residence, that she is a student, where does she study, she studies in grade 1, when did she come to the OPD, which hospital, the date and the time. Okay, everything is written over here. Next we move on to the presenting complaint. She complains of ear discharge for the past 3 years and post-auricular lesion for the past 3 weeks. Okay, so she has an ear discharge for the past 3 years. the thing which happened the earliest, we're going to mention it first, because this is what chronological order means. Okay, and the thing which happens later, we will write it later. Okay, next we move on to the HOPC, that is history of presenting complaint. And the first thing which we're going to focus is the ear discharge, because we have mentioned ear discharge first in our presenting complaint. The patient reports being in her usual state of health until 3 years ago, when she begins experiencing ear discharge. The discharge is gradual in onset, it is progressive in nature. It is described as continuous, scanty in quality, yellowish, mucopurulent, foul smelling, and occasionally blood tinged. Okay, so you have to write all the characteristics of the discharge. You will write what it worsens with. It worsens with water entry into the ear. How is it relieved? It is relieved by the use of ear drops. Now, 3 weeks prior to the presentation, the patient develops post-auricular swelling on the left side. You will mention which side is it. Is it bilateral or unilateral? And this burst after 5 days. This was a swelling and this burst, and this released a yellowish, foul smelling, blood tinged mucopurulent discharge. Okay, there is a discharge from the ear as well, and there is a discharge from this swelling as well. And then you will mention any associated symptoms like fever, headache, or any other symptoms. Okay, next you will mention about the history of hearing loss. There is also a history of hearing loss since the past 3 years, particularly on the left side. She cannot appreciate low voices, but she can hear loud sounds. Okay, hearing loss is constant. There is no difficulty. It is not worsening. It is not improving. It is just constant. There is no difficulty in understanding spoken words and even in noisy places. So you have asked about the conductive and sensorineural deafness, that there is no difficulty in understanding noisy places. Understanding words in noisy places or understanding spoken language. Okay. Next, you will ask about the history of exposure, trauma, or the use of ototoxic drugs, and there is no history, and the patient has a history of ear surgery 5 years ago for similar complaints of left ear discharge. So she had a surgery, but she does not have a history of ototoxic drugs. She also has a history of right ear discharge 3 years ago, which was scanty, yellowish, foul smelling, gradual in onset. So you have to mention the onset, the characteristics, color, smell, etc. Okay, and the duration, the time, the quantity, etc. Everything. So she had the history of right ear discharge, but this also resolved. Okay, so that is why I mentioned this in the end. Next, you will ask about the associated symptoms. There is no history of vertigo, tinnitus, nausea, vomiting, neck stiffness, trauma. Okay, these are all the associated symptoms. She had facial nerve weakness on the left side following her ear surgery, which improved after 3 months with physiotherapy and medication. Okay, you will ask about the surgery, ear surgery, and also facial weakness, because we know that facial nerve is related to all these things. Okay, and one of the branch of the facial nerve passes from the middle ear as well. That is why it is very important in the history of the ear to ask about the facial weakness, that whether the facial nerve has been triggered or not. There is no swelling or pain in the head or neck region, no nasal obstruction, discharge, or epistaxis. You have asked about the history of the nose as well and the history of the throat, that there is no other swelling anywhere else, there is no radiation, no nasal issues. Okay, next we have already discussed. You will ask about the past medical history, past surgical history, that she had this surgery. Where did she have this? She had that at JPMC, Jinnah Postgraduate Medical Center. You will ask about the drug history, that whether she whatever she consumes, so she consumes betel nut every single day. Next, since she is a female, you will ask about the past gynecological, past obstetric history, allergy history, history of anemia, blood transfusion, family history, occupational history, immunization, nutritional, personal, and you will also ask about the environmental history and socioeconomic status, and also the systematic review. So this was the whole format of history taking of the ear. And the things which we are going to focus on, the headings which we are going to focus on, is this criteria Socrates for pain, you have to remember this, and OPQRST for any other symptom. You will ask about the onset, how it progresses, the quality, radiation, severity, and the timing. Then you will ask about the ear discharge, if it is there. There are some questions which you're going to ask. Then you will ask about the hearing loss, ear pain, tinnitus, okay, their character, whether it is unilateral or bilateral. You will ask about vertigo, whether it is just lightheadedness or it is true spinning. Then you will ask a bit about nose and throat, and this will come under the heading of systematic review, that her other systematic review was unremarkable, and there were no other ENT complaints of nasal obstruction, discharge, bleeding, or dysphagia, or any other throat complaints. So this was the whole heading. These were the whole headings of our history taking, and I hope you understood them. And if you have any questions, you can ask them in the comment section. Thank you so much.